All right, now we want to bring in Dr. Michael Osterholm. He is the director of the Center for Infectious Disease Research and Policy at the University of Minnesota, and he was also a member of President Biden's Transition COVID-19 Advisory Board. Dr. Osterholm, good morning to you. Thank you for being here.
Good morning,
I want to ask you, good to see you. I want to ask you about something that you have said. You said that Omicron could be a, quote, viral blizzard, and now here we are, more than 1 million cases a day, and yet we are starting to see that case number drop in some cities and states. So how long do you think it will be before we peak?
Well, when I first suggested this was going to be a viral blizzard, it was about 5 weeks ago, and I said that it would be up through 8 to 9 weeks that this would happen, and we're right on target for that. I think that you're going to see, in fact, as you note, in the Northeast in particular, the case numbers may have peaked. But remember, that still means a lot of cases are coming in every day. Nationwide, I think we're at least 3 to 4 weeks off before we see that peak and the numbers start to drop. I'd also remind people that it doesn't mean it's over with at that time. If you look at South Africa, the numbers went up very, very quickly and then came down quickly, but there's still about 25 times the number of cases now in South Africa today than there were before the Omicron peak started. So it doesn't mean that it ends in 3 or 4 weeks. It just means that the numbers will come down, I think, quite substantially.
And Dr. Osterholm, about the changing mask guidance from the CDC now saying it's okay to wear those N95 or KN95 masks. There had been concern about shortages of them in the past. So simply put, what is your message to those Americans who are still wearing the surgical or cloth masks at this point?
Well, you know, at this point, I have to say I'm glad to see that the CDC has made some movement. It's far too late. We knew a year ago that they should be wearing N95s as a routine and that there were plenty of them in this country. So, you know, I welcome the new news, but it surely is late in coming. Second of all, the recommendations are, I best call tepid. They mean you can wear them. I don't think that's right. I think you must wear them. This virus is highly infectious, and cloth face coverings and even surgical masks are just not adequate in keeping it out. So my message is you can do a lot to protect yourself by wearing a tight face-fitting N95. You will not be taking them from other healthcare workers. We have plenty right now, and this is an important step in protecting yourself in addition to being vaccinated.
Well, that is a clear and definitive message. Dr. Osterholm, let's talk about kids. When you think about vaccination rates, more than 75% of adults are vaccinated. But when it comes to kids who are eligible, those 5 to 11-year-olds, it drops significantly to 17%. How concerning is that figure given the increase in hospitalizations among kids?
Well, I think it's a real concern, Kristen, and what it really signals is we are having a terrible time turning vaccines into vaccinations. And right now, a vaccine availability doesn't mean much if we can't get kids vaccinated. And you've already covered the fact that we're seeing major increases in cases and presenting to hospitals in young kids. So we need to keep emphasizing the importance of getting these vaccines in. You know, we've had such a divisive period with regarding to schools. You know, I have been saying for some time, I don't think schools can be open in many locations right now, not because the kids shouldn't be in school. We want them in school. The problem is that we have so many teachers and support staff and bus drivers out. When you have 35% of your teachers out, how do you actually conduct school? Yeah. But that's going to be short-lived. That's just the next 3 to 4 weeks, and we just have to get through that period. And please get your kids vaccinated.
And we are going to delve more into schools and how some of them are getting creative to keep kids in the classrooms coming up in our next half hour. Dr. Osterholm, it is always so good to have you on. Thank you.
Thank you.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.